um, something that you feel like you don't want other people to know that you don't know, feel free to call, email, text me. It's kept in confidence. We meet every month on the second Wednesday from 9:30 to 10:30. People jump in, and stay for as long as they can. But the goal is to really get all of us connected, get us the information that we need, and to see each other as human beings. Particularly in the current environment, there's a lot of transition going on in the world. So I think it's going to be extra important for us to really know each other. So with that, I'm going to bounce around and have everybody introduce themselves, and then I have a guest today. So let's see. Laura Jones, how about you go first?
Okay. Am I unmuted?
You are.
Okay. I'm Laura Jones. I'm from the East Providence Senior Center. I'm the Director of Senior Services for the City of East Providence.
Awesome. Carla, Carla Vega Wanan. And please correct me if I say your name wrong.
Yep, you said it perfectly. Thank you. I work at East Bay Community Action Program. I'm the Director of Community Health.
Awesome. And Jean Shields.
Morning, everybody. Jean Shields. I'll pop on here for a second. Oh, it won't let me.
Or not.
Okay.
Oh, there you are. Oh, we've got the image and now no sound. All right, Jean, we can come back to you. How about Tracy?
All right, am I off mute? Hi.
Hi, Tracy.
Hello, I'm Tracy Causey, and I'm a nurse care manager. I work for Lifespan Brown University Health as a nurse care manager in a physician's practice.
Oh, okay. Awesome. Jean, I saw you come. Oh,
Yeah, it bounced me right out.
mm,
There I am. So, Jean Shields from Tri-County Community Action Agency, FCCP. So, for those who are new, Family Care Community Partnership. I work out of the Wakefield office, but our headquarters are in Johnston, and we have a Westerly office and a North Kingstown office. And we help families who have a kiddo in the home from 0 to 18 get connected with resources. We can stay open with a family 6 months or so. So nice to see everybody today. Happy Wednesday.
awesome. Jean, are you able to help grandparents or foster parent, like
Yes, we
kinship?
can, as long as they have the child is primary. So as long as they have a child in the home. So what we do is we connect them. It could be a DV, it could be multiple, it could be multifaceted. As an FSP. I'm brought in on the more complex cases. And it could be DV, it could be a 504, an IEP. They might need a medical advocate, they might need to make phone calls, they might need doctors and dentist appointments. Whatever, it's their voice and their choice, and no judgment on our part.
Awesome. Thank you. How about Dakota Gadsden?
Hi. Hi, my name is Dakota. I am a community health worker with Connecting for Children and Families here in Woonsocket, Rhode Island. Um, we work with just a whole variety of clients from all ages. However, I have been focused more on working with the older adults. And this is my first time on this meeting, and so I just wanted to jump on, see kind of what it's about, and yeah, kind of join in from here on.
Awesome. Welcome. And Nicole.
Hi, this is my first meeting as well. Thanks, Deb. Both Debs. I am new with assisted living locators, and I'm also getting my geriatric care manager certification. I'm also a nurse. I was in the SNF world for like 13 years. That's how I met Deb. So if anyone is in need of senior housing placement, including assisted living, independent living, memory care, they can reach out to me and I can help them do everything. It's no cost to them.
Awesome. Thank you. Is there
Thank you.
anybody I missed? Did I get everybody? Okay. So, uh,
Grabbing a Kleenex. Be right there. You can
okay.
talk about me.
So,
Oh, Deb's the best.
Yeah, I've known Deb for a number of years, and we talk often about managing medications, mismanagement of medications, and how taking care of that med box is kind of like one of the things that takes a lot of brain power and concentration,
Yeah.
and a mix-up can be deadly. So Deborah's an excellent communicator about managing medications, ways to do it effectively and easily. So I figured let me have her on because we've also had along the way changes in some of what the pharmacies, your local pharmacies will do. And that has caused some chaos for some of our homebound seniors. So Deborah Demar, take it away.
Thank you, Deb. Appreciate the invitation. I really was not making, when you said it, speak for 30 or 40 minutes, I'm like, I could do that about the White Cross Pharmacy and MedPAC all day long. But when you said talk about med management and not knowing who my audience was going to be, I did a little work when I got home from work last night, and I
Thank you
don't
for
want to bore
trusting me.
you. What's that? Pardon?
Thank you for trusting me.
You're welcome. So there will be a little word from your sponsor, White Cross Pharmacy, at the end. And you'll all be able to ask any questions you want. But I did make a lot of notes. So if I'm not making eye contact directly with the camera, bear with me. And I don't want to inundate you with, heady stuff. But it is really, I find it really interesting. So, and I know Deb loves statistics. So you're going to love this. So med errors rank as the most frequent and avoidable source of patient harm. I'm going to share some statistics with you. So adverse drug events, which are often initialed ADEs, adverse drug events, they account for more than 3.5 million physician office visits annually and nearly 1 million visits to the emergency room. Now, if you think about seniors who may be having adverse drug events, ADEs, and going to the hospital, imagine that they're probably being taken by rescue. If only half of them needed a 911 call by ambulance, that's 1 million ambulance rides per year. Yeah, pretty like, wow. ADEs account for nearly 100,000 hospitalizations each year. And at discharge, at least 30% of patients have at least one discrepancy on discharge. So later we can talk about the importance of doing a med reconciliation. While in the hospital, 3% of patients are harmed by medication errors that can result in an additional 8 to 12 hospitalization days to take care of this med error and its result. Med errors in the acute setting are approximately 6.5 per 100 admissions. Those odds. I don't like those odds at all. And approximately 100,000 people die annually in the US as a result of a medication mistake. Now, what's really interesting is that half of those fatal medication errors, like 500,000 of those fatal medication errors, occur in people over the age of, who wants to take a guess?
55.
Close, 60. Yeah, 60. And well, sign me up. Hopefully I'm the other 50. And that these preventable errors cost about $21 billion annually across all care settings. So that's with a B, billion. So what is a medication error? It occurs from the moment that prescription is written. Oops, so sorry. From the moment that the script is written to the point that the patient receives and starts taking that medication. They call it an error of commission or omission. And we're not just blaming we're not just blaming the patient here for med errors. It is doctor's handwriting stinks. Thankfully, there's e-scripting, so that takes away that potential mistake. A tap of a keystroke could change a dosage, make a dosage change. So it's not just you can't just blame it on the patient. There are what's called the 5 rights of medication safety. Does anybody know what the 5? I know Nicole, as a nurse, you would know. Anyone else? The 5 rights of medication safety is the right medication in the right dose at the right time by the right route, usually oral, maybe not, to the correct patient, to the right patient. So non-adherence is going to be the wrong dose or the wrong time or forgetting to take the dose or stopping too soon or in an acute setting or skilled or assisted living, passing the meds to the wrong patient or an individual. So some of the signs of mismanaged medication would include symptoms such as confusion, dizziness, and unusual drowsiness. And in the elderly, there can be changes in vision, loss of coordination, or sudden drops in blood pressure that lead to further risk of falls. And the caregivers and healthcare providers should watch for behaviors such as skipping doses, taking the incorrect dose, or hoarding medications. And often these can be a sign of other things going on, cognitive issues, other health-related issues, as well as the simple understanding of what that medication is for. And that will then lead to falls and trips to the emergency room. So not only are we concerned about prescription medication, but over-the-counter medications can increase the risk as much as a prescription. For example, let's say naproxen is available in an individual bottle, but it may also be part of a prescription item, or an aspirin that they're used to taking can be part of a combination of a prescribed medication, and they may not know that that naproxen is in the medication that was prescribed, but they're used to taking it out of a bottle, and they will do that as well. So education, it's all about communication and education. Also, seniors often need to go to the bathroom more frequently, and if they were just rushing to go to the bathroom, especially in the dark, and now they have taken something for sleeping, the risk of fall is greater as well. And falls occur because one doctor often doesn't know what another doctor is prescribing. And that's why I think the multi-dose packaging that we provide, that gives us a clear picture every month on everything someone's taking. I don't know another pharmacy that when they fill one script is seeing everything listed. The computer may kick back a flag like this is contraindicated with that. But we get to see the polypharmacy when that's occurring. We can talk about polypharmacy as well.
Deb, one of the things, for those folks who maybe don't know, I had a loved one have major surgery recently. And one of the things that I found really interesting is that although both the doctor, the surgeon, the hospital, and the two imaging companies all fall under, I'll just say, one umbrella here in the state, the electronic medical records did not communicate with each other. And so I could see where the medication from one doctor, even though the front-facing electronic medical record looked very similar among all the different providers, those records did not have the same information. So I can definitely see this happening where the patient is looking at their records thinking that they have an accurate reflection of what they're taking, but all of the records really aren't there. Yeah.
Yeah.
Sorry to interrupt.
No worries. Thank you for that. So there are certain classes of drugs, such as antidepressants, pain medications, antipsychotics, and antihypertensives that can be particularly problematic for elders. And when a new drug is brought on the market and tested, they include younger, healthier, older adults. They're not being tested on the oldest and most frail elders. And they don't necessarily, elders don't metabolize and excrete drugs as fast as younger individuals. And so these drugs can build up in their system and cause more side effects. Even a physician knowledgeable about a medication side effects may not know how it affects an older patient. Now, if you knew the amount of time that a doctor spends in medical school learning about pharmacy,
Mhm.
Pharmacology, that much, someone says that much. Compared to with the pharmacist, your best friend is the pharmacist.
Mhm.
Communicating, if you have direct patient care and you have anything to do with medication management, get the name of your pharmacist and develop a relationship with them. So starting a new medication can also have side effects for the first few days as it's getting into someone's system. So an older adult needs to become more accustomed. And like I said before, like a sleeping medication taken for the first time is individual have a much greater risk of falling first couple of days that they're taking it, especially if they drink alcohol.
Mhm.
Ah,
Mm.
yes. So let me see what I'm going to jump to here. So I'm going to talk about why I'm such a proponent of multi-dose pouches packaging. They offer a range of benefits. They enhance patient convenience. You know what? I think I missed something. Hold on a second. I knew it. All right. I want to talk about patients being discharged from hospitals in skilled nursing. A patient being discharged from a hospital is going home with prescriptions. Unless that hospital has a pharmacy that they send them home with maybe a week's supply to get them time, buy them time to get to a pharmacy. It's not, they don't all do. Or maybe they'll fill for a month. Um, Typically, they're going home with prescriptions. It could be a brand new medication regimen. It could simply be dosage changes. Or in a skilled nursing facility, we know they're going home with the single dose blister cards, whatever's left, they paid for it. Insurance paid for it, and they get to go home with it. Maybe they have 2 of these and they in the pack, and maybe they have 10 of this in the pack. And now they go home and they start taking that along with everything they took before.
Yeah.
Again, med reconciliation is so important, and which is why I believe every discharge needs to come with at least a home care visit to assess the home for safety, and that safety includes not just hazards in the home and loose rugs and slip and fall issues or furniture placed too closely together, which creates a trip hazard, but medication reconciliation so a person truly understands what they're supposed to be on. Now I'm going to talk about multi-dose packaging. So White Cross Pharmacy has been doing multi-dose packaging I've been with them 8 years. They had already been doing it about 4, so at least 12 years. A little bit about us. I'll talk about adherence first. Why multi-dose? It enhances patient convenience, adherence, safety, and independence. And while many seniors will say, "Oh, thank God I don't need that," I go, "Do you need the remote control? You don't get out of the chair to change a channel, right? You could, but you don't."
Mhm.
So, um, independence, it allows them to not necessarily have to rely on a family member anymore if they're challenged with transportation issues, vision issues, sitting and sorting on a weekly basis. I say to them, we're not just on the back nine, we're closing in on the clubhouse here. So what wouldn't you like to have an hour back in your life? Once a week, or when your daughter comes to visit you on a weekly basis, why don't you get a manicure together or go out for lunch instead of take that time she has to sit and sort your medications?
Mhm.
Now, multi-dose isn't for every environment where there's in busy environments, let's say assisted living, where they're standing in the hallway with the med cart and patients are coming up to them. Very often, med techs are passing by memory, as we say. "Oh, Deb Burton, hi, good morning. Here are your morning meds." And they don't necessarily look at the MARS, the medication administration records. When I started 8 years ago, we were just getting people on electronic records, and we're still converting some of our buildings because we have contracts with assisted living buildings to use electronic medication records, which means that they can click off as they pass. But when it was on paper, they pass and then go back to the med room with the big book with all the med sheets in it, and they'd just go, "Yep, gave her, yep, 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 yep." And they're not
Yeah.
looking at things that may have had a dosage change or something that was no longer being given. So lots of med errors happening in that setting.
Mhm.
So now a word from your sponsor. So White Cross Pharmacy is Rhode Island's oldest independent family-owned pharmacy. Is there anyone who has not heard of White Cross? Anybody? I know we do a lot of partnering with pretty much everybody here, so I appreciate that. Um, we're not just the med pack though. You need to know we can put medication in bottles 30 days or 90 days. We can do single dose blister cards, which is great if there's a narcotic and someone's overseeing care and you want to be able to do an easy count because they're numbered. There's the multi-dose card, call them like little cubes, a week at a time. I'm not as much a fan of that. You need more dexterity to get those open, or people are stabbing them with a pen or a knife, and I'm not a big fan. And then we have the med pack. And in addition, we have all your over-the-counter products, insulin, diabetic supplies, your Lances, needles, glucometers, anything that doctor wants a patient to have. If we can get a prescription for it, it could be a splint for a wrist post-surgery. We can fill those prescriptions. There's no charge for our packaging and delivery. But what I want to tell you about is the safety issues that we take control of in order to ensure safety. We have a computerized camera, and most people don't know this, but what we do is every pack, the month supply on a roll, is fed through this computerized camera that goes through rollers, hopefully to flatten the pills out. There are barcodes on every single pouch. The barcode indicates the patient and what's supposed to be in each pack, at what time of day it's being administered. It takes a picture of every single pouch. It then sends pictures of all these pouches to a pharmacist sitting in a room with a big screen. And they now are looking at the packs. They have a basket next to them with all those packs. And each pack is going to have a red, yellow, or green square around the pack. Green means, according to the barcode, that everything passes muster, everything's accurate. Yellow means, geez, I better double check this. What is this? And 3 means something's wrong. So sometimes the camera cannot read a gel caplet. Think of a vitamin E caplet or something that's, colored but clear gel. Can't read the imprint on the pill. And the camera is doing that. It's reading the imprint on the pill. So the pharmacist looks at all those and goes, oh, that's, make that green. Those are all those silly caplets. Red could be, there's supposed to be 3 pouches and 3 pills and 3 pills in consecutive pouches, but instead there's 2 and 4. Maybe 1 pill jumped into the next pouch before it's sealed. And if that's the case, it gets manually flagged by the pharmacist, sent out to a pharmacy technician who manually, with a razor blade, opens that, takes the pill, adjusts the pouches, and indicates on the top of the pack that there has been a manual adjustment. Sometimes we get a last minute addition to the packs. Everything's printed and we get a new script. We have a whole team sitting there with razor blades opening every breakfast pouch for a month and adding a pill in and indicating the name of, there's a label placed on it which indicates the dosage, the quantity, prescriber, the description. Every pouch has every pill listed and is legally labeled for travel. It's not just for elders, it's for everyone. If you have a pet on a people med, we're going to fill that for you too, and you just pay cash for that. So when you're at home and you're talking to your partner, honey, did you give the dog the pill? And they go, I thought you gave the dog the pill. And you're looking at the bottle and you're like, I know I was going to give the dog the pill, but I thought you were giving the dog. And then you
This
don't
is
know.
such a regular conversation at my house.
There you go. So we can put the meds in the pouch. You look at the box. If the pack is gone, one of you gave the pill. It's if children are going to school with medication, it falls out of their backpack and has their name on it. It describes it. It's not like finding a Ziploc bag, a Kleenex with a rubber band around it. So we have, and any given day, we have a minimum of 5 pharmacists, usually between 5 to 6 pharmacists on, and we have 30 pharmacy technicians. We don't have turnover. We're growing, but some of our pharmacists have been there 10, 20, 30 years. We've been around since 1933. I think it speaks volumes for our company that it does that. My role is to educate people, so I'm happy to have this opportunity. Yesterday, I was sitting in the apartment of an individual, one of my resident service coordinators had given my information to an individual. She called me, and I told her, "Oh, I'll pass your number along to the pharmacy intake team. They'll give you a call." And as I was talking with her, I realized even on the phone, she's going to have a problem doing this. I made an appointment. I went to her apartment yesterday, um, took a picture of, fortunately, she had a nice active medication list. She had her doctor's names and their phone numbers. So I was able to scan that, took pictures of her cards, form of payment, everything. She would not have been able to do this. And not everybody has somebody who is available to help them. I don't have children. I don't know. I'll be calling on Nicole. So it's great to be able to have an advocate, and I feel badly really for those who just don't have someone helping them. The MedPack is a great solution for it. Free delivery by drivers to the door. No exchange of money. We set up an account. They just pay their copay. No added charges for the packaging or delivery. And I hope that we can keep as many individuals, regardless of their age and where they live, safe.
So, Deb, with the delivery, do you guys cover like the whole state? Because I know, like
Yeah.
for home health care workers, things like that, going out to like Little Compton, Tiverton, Burrillville, West Coventry, I think you'd find chicken teeth faster than a healthcare worker. Can you guys cover all of it?
We cover the entire state. We also deliver to North Attleboro. We deliver from Fall River out to Fairhaven, Mass. Where in areas that we do not drive to, we use UPS. So UPS directly to the door. And if someone's in an apartment building, we're not leaving it. We're ringing the apartment door. They have a little, signature pad. They just like a UPS driver, and you just sign the signature pad. Our drivers have pads as well. We can deliver narcotics. So what doesn't go in the pack would be meds that are taken only as necessary, your PRNs as necessary, Coumadin, blood thinners, things that might be all going up and down during the course of the month. Individuals have to call us in order to refill certain things. For example, PRNs, we don't know when you're taking it, so we don't know how frequently you're going through it. So we need a call in order to do that. We call the pharmacy to at startup to transfer your prescriptions to us. We do a med rec between your primary care physician and the medications that we get the list of from the patient and the list and the scripts we got from, or the transfers we get from the pharmacy. And we'll be calling a doctor if it looks like the cardiologist is prescribing something very similar to what the PCP is, and they haven't communicated. So I always encourage individuals, please make sure your primary care knows everything you are taking, whether it's over the counter or prescribed by another physician. And then we will call the doctor if we get transfer scripts and there's no refills, we're going to call and get those refilled. Our new system for starting up a patient is that we will begin by delivering bottles. It might be 10 pills in this one and 20 pills in that and 30 pills in that. And that's how we get everything to synchronize to refill at the same time. And then the patient is told the week that their med pack will be delivered and the exact day that they're starting. Every box starts on a Friday. So we know we have Sunday through Wednesday for regular deliveries, Thursday for emergency deliveries or for updating packs as necessary with that last minute change. And then every pack starts on a Friday.
Do you guys take the Medicaid insurance?
We do. We take all insurances. However, we do not have the VA contract.
Okay.
If a vet has a Part D plan or TRICARE, we do take those insurance. We do take any Part D plan and we do take TRICARE.
Okay. If somebody is looking, say they have a cold and they want to have cold medicine delivered with the medicine, with their regular meds, is there a flag or any kind of alert in the system that's like, oh, that cold medicine might not be the best choice with that cardiac medicine?
Yeah. Yeah,
That's all.
that's a very good question. I'm gonna say yes because we don't have people dropping on us because of it.
That's good.
I am going to the pharmacy later. I'm going to ask that directly of Bob, the owner. And I do like to say, I don't know where else other than maybe a small independent pharmacy where you can, and we're not small, we're rather large, that you can call and talk to the owner of the pharmacy and the head pharmacist.
Yeah.
And he cares. He really cares. We are the pharmacy for over 15 assisted living communities, multiple group homes throughout all of Rhode Island, over 4,000 patients in the community throughout the state of Rhode Island and Massachusetts. I'm just making a quick note here. Contraindicated with meds.
And one other question, because I know sometimes we have individuals here who are serving our homeless population. Are you able to deliver to a homeless shelter?
We are. Yes,
Okay.
we have.
That's good because I know that that's sometimes a challenge for folks to be able to get to a pharmacy and or to have the medication packaged in a way that is legal and okay. Does anybody besides me have questions?
Oh, I'm not that good. Come on.
What are folks seeing out there with their older adults and the medications?
This is Jean from Tri-County. So as a former 911 paramedic, I just wanted to let the presenter know that was excellent overview. Yeah, so really nice, and the statistics really help to bring it home. The only other thing that I might add is if everyone knows the poison control number, that's a great thing to have. Um, Even if, you find it on the floor. But that's another great place to look too. If you're doing a reconciliation, just because their hands get frail, they might not, they do scooping. I used to call it scooping. They scoop it and then they just do one big chug. And some of those little pills, can slip out and you might find them on the floor. Um, so I just wanted to add that, but that was just a wonderful overview.
Thank you,
Um,
Jean. Appreciate that. Uh, I have produced a magnet. I don't have one in here. It's in my car. I have a case of them in my car. And it has White Cross Pharmacy's logo and phone number at the top. The magnet's only this large, but the card is like a full-size rack card for poison control hospital. You write your street and your intersection, your closest intersection, and the instructions for getting into the building that you need to be able to impart to someone, which in an emergency, all of that goes out of your brain and you don't think about it. Like maybe you always keep your slider door unlocked and you don't want them breaking through the front door, but you don't think about that when you're in a panic mode. So I think I just had 2,000 printed and I give them out at fairs, and I do a lot of speaking at high-rise buildings. As a matter of fact, if I was closer to my calendar, I'm going to be in Woonsocket hitting all four of their senior housing buildings, and like Kennedy Manor, I believe, is one of them. And I'm doing like 9:30 in the morning, then 11, then 1, then 2:30, meeting with residents and trying to share whatever information I can.
and if
And
I
some
could just share a little story, I have a 81-year-old cousin who I thought was relatively healthy. Then when I started to help advocate, I realized there was a more extensive history. And I just want to throw this little caveat out there. So my cousin was going to be undergoing some procedures. And leading up to that, there was a great deal of anxiety. Um, had, pill boxes, if you will. But what happened, there was anxiety the night before the procedure. And in the anxiety moment, switched AM meds for PM meds. So took the AM meds at night. Um, and I was with her then. So she didn't realize the error until the morning, because she's never been assisted with, if you will, med management or med reconciliation. So she said to me, am I going to be able to do my procedure? And I said, you're going to let them know you had a med error. I said, but in that, in that 8 hours that you slept, you're breathing, you're talking, you're alert, so we were able to bring that anxiety down. But, you have to say something when they're at this heightened state. That's when those errors can occur.
Yeah. Think, go
I
ahead, Deb.
want, I want to show a picture if I can hold it up to the camera and you can see it. So I had asked the woman I was helping yesterday for the number of her pharmacy she went to, and she's like, "Oh," I'm like, it's going to be on a pill bottle. Um, and most people are keeping it in the center of their kitchen table or easy access. She goes, "Oh, it's in my husband's bedroom. It was a 2-bedroom apartment." And I said, and she was having trouble getting around. And would you like me to do that? She goes, "Yeah, it's in the bureau." I go to the bureau and she goes, "It's in the second drawer." And I had to take a picture of it. I don't know. Can
Oh,
let me
oh,
see.
it blocks out. If you unblur, at a distance, you can that's a whole drawer of drugs.
And the top and,
Oh
and the
my.
upper level.
Yeah.
I don't know why that's happening.
So where everybody is located, where do you dispose of drugs? Where are the places
Well,
in
they
your
have
towns for
medication
everybody?
take back days, fire departments and police departments. So you might want to look for those. But honestly, when I have been to, I hate to have to say it, CVS in the back of the store, they do have disposal boxes. So you can bring things there.
Laura, in East Providence, where are the drug take back boxes?
Well, when I became director here at the East Providence Senior Center, they had a box sitting on the counter in here, and the seniors would just throw their meds in there. And I was like, oh my goodness, there was opioids in there and everything. And I was like, no, we're not doing this. We're not storing medications here. All I could see was somebody taking them and them getting into the wrong hands. So the police department used to have a bin, but then they stopped doing it because they had to then dispose of them and drive them somewhere, which was, I guess, a little far away. But we just tell them to go to CVS. Um, but yeah,
Is it
Um,
the CVS right in the, oh Lord, you want to know how old I am? I'm going to say in the Zayers Plaza. The Shaw's Plaza there, right by the senior center, that CVS, or is it the one across from
I think
like
it's the one on
Mobile?
Pawtucket Avenue. Yeah.
Okay. Yep.
some
But
people
Dakota,
that
how about Woonsocket? Where is there a drug take back box in Woonsocket?
So I was actually trying to reach out to some of the fire departments here just to kind of see about their take back days. But we do have it at the Walgreens right on Social Street here. And then I know the CVS over on Cass Ave near the Woonsocket High School has one as well, next to their pharmacy. But before I was trying to find the resource because I actually had previously worked as a certified pharmacy tech too in Rhode Island Hospital, CVS in Kent. Um, and there was a resource for explaining to people how they can go about properly disposing medication, even if they can't get to a take back box or get to the fire station, how they can do it at their own home, whether it be flushing it or kind of crushing up the pills that can be crushed up. And there's a whole list of like the medication that can be crushed and some the ones that can't. And then how they can go about disposing that, whether it be mixing it with like an acidic liquid or something and then pouring it down the drain. Um,
no drain.
yeah, well, originally they said toilet, but yeah.
I say cat litter or coffee grounds and then put it in a bag, tie it all up.
Yeah, the coffee grounds that's what I had used before.
Yeah.
Um, yeah.
No
Um,
one's touching anything in cat litter, in dirty cat litter.
Oh yeah, no.
Just
Mariana,
saying.
you came in a little bit after, so I wasn't sure where you were from, and if you could share where you're from, but also if you know where the drug take back boxes are in your community. Are you there? Or maybe not.
No, I'm sorry.
Oh,
I'm here. My audio was off on my computer screens. I couldn't get there quick enough.
no
Um, I'm
worries.
actually I'm actually from the Point, so
Oh,
we don't have take back boxes here. It's usually whoever does the servicing, right, for the clients, but we just help them with the information on where to go. So I like to enter your meetings because you always have, the speakers and then gives us the knowledge of where to refer people out to. So, and we help sign them up for services. So, um, yeah, sorry about that.
no, no, that's okay. I didn't know if you had like even a list of where those boxes might be that we can share to make sure that people are safe too.
Yeah, I
Um,
probably do. I just have to go and research it out of my database. But once I do, I'll email it to you if that's all
awesome.
right.
Yeah, no, that would be great. I know there's a drug take back box in Johnston, and there is a drug take back box in the state police barracks on Route 6 in Situate, the Situate Police Barracks. I know that they're there. Nicole, in your community, do you know where the boxes are?
Sorry, I took a phone call, but for drug take back, don't they just take them? Do they take them at like CVS? I've seen a box or maybe not. No?
Hmm. Yeah, no, that's some of the places. Yeah, I'm just trying to get a sense of where folks might know where to drop them off at. Deb, I
Deb, I
Yeah.
wanted,
can add to that.
yeah, please.
Um, I'll double check now that you got me curious, but I believe the Westerly Police Department, if you're in the southern part of the state, they used to
Okay.
have one right as you walk in on the lobby to the right.
Okay. Excellent. Excellent, excellent, excellent. And Deb, I wanted to ask a question. You had mentioned very briefly about how medication is processed with alcohol. I don't know if you had any more data around that because I know during COVID, the rate of alcohol use skyrocketed.
I don't have any statistics regarding that. Just all I have to say is don't do it. Stop that. Yeah.
Oh, oh goodness. So everybody, we have a little bit of time left. I don't know if anybody had any other questions, any other concerns, anything that they want to see at future meetings. How is everybody feeling with a lot of the funding uncertainty? All of those other things, if you care to share, and we are recording, so things like that. Is anybody seeing stabilization in housing for folks? Better, worse, the same?
I definitely have noticed that the housing situation, especially here in Woonsocket, is getting worse. However, the Section 811 program through Rhode Island Housing has been such an amazing resource. I actually just got one of my clients approved as well as accepted into a Section 811 unit over in Middletown. And the rent is extremely affordable for her. And she had been living in her car for a year and a half. And so, yes,
Yay,
it's,
housing.
yeah, it has been a very long and tough run, but we finally did it. And hoping that moving forward with the Section 811 program, we can continue to get those clients the housing that they need.
Section 811, is that also known as the Section 8 or the voucher program?
So it's similar to the Section 8 voucher program. However, with Section 811, it's focused more on people over, I believe they're doing 62, or
Okay.
people anywhere from 18 to 65 with some type of disability. And so the referral process is different where you have to refer through a case manager, and
Okay.
then that case manager will kind of be in contact with Rhode Island Housing, BHGDH, as well as the property management of whatever Section 811 unit.
And is it something that is limited to, like, my understanding of housing right now, and it's not my area of expertise, is that if somebody wants to get on the aged and disabled housing, they need to go to every unit in every community that they would consider living in order to submit an application. With the Section 811, is it more of like a one-stop shop?
Yeah, so how the process works is when you refer the client through their referral link, then they basically, because one of the criteria is they have to be high users of Medicaid, and so they pull a Medicaid report, and once they're approved for that, they will then send the case manager the pre-application where you will fill that out with all the information from like housing size, disability, all the client's information. And then that goes to all of the property managers that have Section 811 units. Um, and whenever you get to the top of the list, they will reach out to BHDDH and they will confirm if the client still needs the housing. And then they'll send over the application for whatever housing unit. And so you're connected to all the property managers, but once it gets to like maybe two different property management groups have a Section 811 unit that's available, you'll get those applications, and then it's basically the regular application process.
Okay. Are the shelters still full? Or like has
Yes,
that been resolved? They are still full.
yes, they are.
Okay. Okay. I think it's really cool that White Cross is able to deliver to the shelters because I know that that is an issue where if you maybe are in a shelter in Providence, but your regular pharmacy is someplace else, getting from one point to the other becomes that much more of a challenge in what is already a challenging situation. Carla, I'm curious, what are you seeing out there for our older population?
I actually just received a call the other day from a private practice, and they were looking for some support. So this is timely for an individual, but they were looking for more for a long-term support, not the temporary support that you might get from some programs until it's. So they were looking for some long-term support in medication management because the individual was just missing them completely. So that just speaks to just a different layer of um, of assistance that was needed. So we just get more of the cases that need a little bit more support to remain in the home.
Yep.
And so that's all I have to share right now.
That's okay. Didn't mean to like just call you out. I like to have conversations to hear like what are folks seeing out there. Mariana, is there a trend in the calls that you've been getting lately for help? Housing.
So, yeah, housing, it's just a lot of elders are calling us because their houses that they've been living in are being sold and they don't have any way to go. They can't afford the new rates that are out there. They're scared. They've been living in some of them have been living there 30 years and now they're forced to downsize, move. They don't have the financial ability to um, move, not even to pack up their stuff and have somebody physically move that for them. So,
I
we're,
can help with that.
well,
What can I ask what you mean what do you mean they're being forced to move out of their own home?
no, no, no. So, a lot of at least the calls that we get, they're renters.
Oh, I see. Okay.
And so they're trying to move, they're trying to downsize, or
Oh,
they're forced to, and they don't have the ability to have somebody help them pack because they're physically unable to do it. They don't have
um,
the resources to get somebody to actually move them,
okay.
you know.
Oh, that's sad. So under the company I work for, there's another like umbrella called Moving Mentors. It is it is a private pay where I know some of these people that are in elderly house they may not have funds for, but they may. I
Right.
mean, this company will pack you, move you. So I just learned because, and I don't know if anyone knows the answer to this. I reached out to somebody from a housing here because somebody called me and she wants to live in elderly housing, but she's going to end up with like 50 to $60,000 in assets. So I said, I asked someone, is there a cap of what somebody can have in the bank? Because I know they go by your income. And she said, oh, it's all a calculation. Depends on A, B, C, and D. Because I have how can you, I don't understand how you can go to elderly and disability housing and you have like 60 grand or 100 grand in your bank account and then your rent is going on what you get for Social Security. So some of these people, does anyone know the answer to that? It's a
I don't.
calculation.
Right, and every city and town has its own calculation as to what is considered affordable, and it's based on the area, I think it's the area median income.
Oh,
So if your income, this is not actual, this is made up numbers. But
okay.
say your income is $1,000 a month and you want affordable housing. If you
Right.
are applying in East Greenwich, then
Okay.
you may be eligible for low income housing because the overall median income is so much higher in East Greenwich. But if you're applying in, say, Central Falls, $1,000 might actually be more middle income because the overall median income for the community is lower. And that's where it becomes challenging for people to figure out where can I live.
Um,
And so, and there's also wait lists.
yes,
My
I know.
understanding is the housing wait lists are running 2 to 8 years, depending on the community.
Right.
So the idea of going out and, if you have the ability to like go to your local liquor store and grab those extra wine boxes that are super heavy duty, um, to pack and stuff, that's great, but it doesn't necessarily mean that you're going to be able to get into elderly housing in a timely way. Um, housing is one of those things that is a chronic issue right now, and I have concerns that it may be getting worse before it gets better. Um,
Mhm.
we have corporations that are buying up rental properties, um, as a capital, uh, I don't know, investment, I guess, which becomes more challenging for folks. Um, but
Yeah.
we have a lot of uncertainty coming out of Washington, and I think to get through 2025 and the future, it really is going to take all of us putting our thinking caps on, trying to figure out like how do we make these pieces fit together for the people we serve. Um, I see sometimes a lot of unkind words in the media around individuals who work in social services, homeless services, things like that, as to, why are people taking days off, or, why are healthcare workers not just doing more? Because
Yeah.
we're all human too. And so what I hope to continue to foster in this group is really open dialogue of, yeah, you know what? There are days that you are cheering because you got somebody who is sleeping in their car housed, and we want to cheer with you. But we also want to acknowledge that there's days that there was somebody who was housed yesterday that's sleeping in their car today. And that is a hard spot to be the person on the other side of the desk to acknowledge that every day. So that's part of what we hope to foster here. But any last thoughts? We have like 1 minute left. Yes, Deb.
I just want to comment when your question about delivering to shelters, the individual has to be there to receive it. Other individuals will not receive it for them. And typically, when we set up an account, it involves a form of copayment in the event that there's anything that has a copay or an OTC that's not covered. So someone would need either a credit, a debit, or a checking account number.
Awesome.
Okay.
Awesome.
Mhm.
Well, thank you, everybody. I hope you found this helpful and that you share it out with your friends.
Thank you for
And
having me.
yeah,
Appreciate it.
absolutely.
Yeah,
I'm
very
at
helpful.
I'm at Debra, Debra at whitecrosspharmacy.com. Feel free to reach out to me. I can bring sample boxes with MedPack, with Skittles and Tic Tacs. Don't eat all the samples. Or any referral
Guilty.
information that would be helpful for you to get somebody onto safe medication management.
You also have a really cool card for this is my emergency contact.
I do. I have a card on one side. It says I get my prescriptions from. If it's White Cross Pharmacy, you check it. If not, there's a line for the name of your pharmacy and number. On the other side, it says I have a healthcare proxy. Individual puts their name, lists 2 individuals and their phone numbers. Because not everyone is being taken from out of their apartment where there's a file of life on the fridge. They're face planting in Stop and Shop parking lot. So be good to be able to for a paramedic to understand what medications you're on. And we get calls all the time, 24 hours a day. Look with who, you know, he says he was with White Cross, but doesn't know what he's on. So
Awesome.
yeah.
Well, thank you, everybody. I appreciate you coming out and